Bismillahirrahmanirrahim. Assalamu alaikum, dear students. I am Dr. Anam Paryo, and today we are going to learn the osteology of femur. The learning objectives for today's topic are: at the end of this video, the student should be able to identify the bone femur. The student should be able to describe the different parts of the bone. The student should be able to describe the characteristic features of the bone. The student should be able to determine the side of the bone, that this femur belongs to which side, whether right side or left side of the human body. Okay. The femur is the longest bone of the human skeleton. It is the strongest bone present in the human body. The femur is located in the thigh region and is forming two important joints. The femur articulates with the hip bone to form the hip joint. The femur articulates with the tibia to form the knee joint. The femur has three parts. It has an upper end, it has a shaft, and it has a lower end. We will briefly discuss all these different parts. The upper end of the femur has a head, which you can see in the figure. This part of the femur is called as head. It has a constricted part just below the head, which is called as neck of femur. This region is called as neck of femur. It has a greater trochanter, which is a prominent mass, greater trochanter, and a lesser trochanter. You can see in the figure, this small elevation is called as the lesser trochanter. So upper part of the femur has four important characteristic features: head, neck, greater trochanter, and the lesser trochanter. The head of the femur is forming 2/3 of a sphere. You can see over here that the head of the femur is forming 2/3 of a sphere. The head of the femur articulates with the acetabulum of the hip bone to form the hip joint. I am repeating, the head articulates with the acetabulum to form the hip joint. The head has a small depression which is called as fovea capitis. You can see over here that head in the center has a small depression which is called as fovea capitis. This fovea capitis gives attachment to a ligament which is called as ligament of head of femur. It is called as ligament of head of femur. This ligament is attached to the acetabulum of the hip bone. The second characteristic feature present in the upper end is called as the neck. The neck actually connects the head with the shaft. It has an anterior surface and a posterior surface. Now look into the figure. The anterior surface of the neck meets with the shaft at the intertrochanteric line. It is an elevated ridge of bone which is present and it is limiting the neck. You can clearly see into the figure this elevated ridge, this elevated line is called as intertrochanteric line. Inter means between, trochanteric means between the two trochanters, greater trochanter and the lesser trochanter. So I am repeating, the neck is the narrow region which connects the head with the shaft. It has two surfaces, anterior surface and a posterior surface. The anterior surface meets the shaft at the intertrochanteric line. This is the posterior view of the femur. The posterior surface of the neck meets the shaft at the intertrochanteric crust. Now it is slightly more elevated and it is called as intertrochanteric crust. You can see into the figure that the posterior surface of the shaft of the femur, the posterior surface of the neck of the femur meets the shaft at the intertrochanteric crust. The neck has an upper border which is concave and it has a lower border. The neck meets the shaft at an angle of about 125 degrees. This is an image of the upper end in which you can clearly see the features. This is anterior view of the femur. This is head of the femur which is forming about 2/3 of a sphere. The head is articulating with the acetabulum to form the hip joint. The head has a small depression which is called as fovea capitis, to which the ligament of head of femur is attached. The narrow constricted region below the head is called as neck of femur. The neck connects the head with the shaft. It has an anterior surface and a posterior surface. It has an upper border and a lower border. The neck meets with the shaft anteriorly at the intertrochanteric line. You can clearly see the intertrochanteric line. This is the posterior view of the femur to show you the intertrochanteric crust. The posterior surface of the neck meets with the shaft of the femur at the intertrochanteric crust. This is intertrochanteric crust, which is a slightly elevated ridge present on the femur. Now we said that the neck meets with the shaft and it forms an angle of about 125 degrees. This angle helps the femur to stay away from the pelvic bone and makes the person easier to walk. This is called as neck shaft angle and it is about 125 degrees. The next feature which is present in the upper end is the greater trochanter. The greater trochanter is a large prominence that projects up from the junction of neck and the shaft. You can see in the figure, this is a large prominence which is projecting upward from the junction of neck and the shaft. It has three surfaces: anterior surface, a lateral surface, a medial surface. The medial surface has a depression which is called as trochanteric fossa. The medial surface of the greater trochanter has a depression, a fossa, which is called as trochanteric fossa. The greater trochanter has a superior border. This superior border is actually forms the apex of the greater trochanter. So we are revising. The greater trochanter is a large prominence that projects up from the junction of neck and the shaft. It has three surfaces: anterior surface, lateral surface, and a medial surface. The medial surface has a depression which is called as trochanteric fossa. It has a superior border which is called as apex of the greater trochanter. The lesser trochanter. The lesser trochanter is a small prominence that projects from the junction of neck and shaft on the medial side. You can see over here this small prominence which is present at the junction of neck and shaft is called as lesser trochanter of femur. Okay. Now when you look the intertrochanteric crust, when you look carefully the intertrochanteric crust, it has a rounded prominence which is called as quadrate tubercle. In the middle portion of the intertrochanteric crust, there is a small rounded prominence which is called as quadrate tubercle. All these features are important as they provide attachment to the muscles. Now we have completed the upper end of the femur. We will go to the shaft of the femur. But before we move, we will revise the upper end. The upper end has a head, a neck, greater trochanter, and a lesser trochanter. The head has a small depression called as fovea capitis. It forms 2/3 of a sphere and articulates with the hip bone to form the hip joint. The neck meets the shaft anteriorly at the intertrochanteric line and posteriorly at the intertrochanteric crust. The greater trochanter is a large prominence and a lesser trochanter is a small prominence present on the medial side. The shaft of the femur. The shaft of the femur is the long middle portion of the bone. It is the long middle portion of the bone. On both sides, it has an upper end and a lower end. The shaft has three borders. It has a medial border. Now look over here. The head is always directed medially. So this border, which is running downward from the lesser trochanter up to downward towards the medial condyle, this border is called as the medial border. The shaft of the femur has a lateral border. Now look over here. The greater trochanter is always present on the lateral side, and the border which is running downward from the greater trochanter down up to the lateral condyle, this is called as lateral border. So this is medial border which is running down from the lesser trochanter, and this is lateral border which is running down from the greater trochanter. On the posterior aspect of the femur, there is a sharp border which is called as posterior border. This posterior border is also called as linea aspera. The posterior border is also called as linea aspera. So I am repeating. The shaft is the long middle portion. It has three borders. A lateral border which starts from the greater trochanter down up to the lateral condyle of the femur. Condyle is a prominent mass. The medial border runs downward from the lesser trochanter down up to the medial condyle of the femur. It has a posterior border which can be seen on the posterior aspect of the femur, which is also called as linea aspera. In this slide, you can see again the medial border which is running down from the lesser trochanter up to the medial epicondyle of the femur. As well as you can see the lateral border which is extending from the greater trochanter down up to the lateral epicondyle of the femur. The posterior border can be seen in this image. The posterior border is also known as linea aspera. So this is the posterior border. The posterior border is thick, rough crust in the middle 1/3 of the shaft. Now look into the figure. The posterior border is a thick, rough crust in the middle 1/3 of the shaft. While you can see that in the upper part as well as in the lower part, it diverges to form the medial and the lateral lips. Look over here. This is the lateral lip and this is the medial lip of the linea aspera in the upper end, and this is the lateral lip and the medial lip of the linea aspera in the lower end. The medial lip of the linea aspera is continuous above with the spiral line. You can see over here in this figure, this is linea aspera and the medial lip is running upward and it becomes continuous with the spiral line. The lateral lip of the linea aspera is continuous above with a tuberosity called as gluteal tuberosity. In the lower part, the medial lip and the lateral lip of the linea aspera are continuous with the medial and the lateral supracondylar ridges of the femur. Now you can see these are the condyles, the medial condyle and the lateral condyle. These are the ridges, the medial supracondylar. Supra means above. The medial supracondylar ridge, and this is the lateral supracondylar ridge. They are getting meeting or they are becoming continuous with the medial and the lateral lips of the linea aspera. So we said that, I'm repeating, we said that posterior border is also called as linea aspera. It is a thick, rough crust in the middle portion, and in the upper portion as well as in the lower portion it diverges to form the medial lip and the lateral lip. In the upper part, the medial lip is continuous with the spiral line, and the lateral lip is continuous with the gluteal tuberosity, while in the lower part, the medial lip is continuous with the medial supracondylar ridge, and the lateral lip is continuous with the lateral supracondylar ridge of the femur. The femur has three surfaces: anterior surface, medial surface, and a lateral surface. Now, the anterior surface lies between the medial and the lateral border. So you can see that this surface is the anterior surface, which is present between the medial border and the lateral border. This surface is the lateral surface, which lies between the lateral border and the posterior border. And this thin part, this thin region of the bone is actually the medial surface, which is present between the medial border and the posterior border of the femur. The posterior surface of shaft of the femur, it has upper posterior surface and a lower posterior surface. First of all, we said that femur has three surfaces: anterior surface, medial surface, and a lateral surface. But in the posterior aspect of the femur, because of divergence of the linea aspera, because of the medial and the lateral lips of the linea aspera, one more surface is formed, which is called as the posterior surface, which is called as posterior surface of the femur. Now you can see over here in the upper part, the two lips of linea aspera meet with the spiral line and with the gluteal tuberosity. They have created a triangular area. This triangular area is called as upper posterior surface. It lies between the spiral line and the gluteal tuberosity. Similarly, there is a lower posterior surface which lies between the medial and the lateral supracondylar ridges of the femur, and this lower posterior surface is called as the popliteal surface. This lower posterior surface is called as the popliteal surface, and it is bounded by the medial and the lateral supracondylar ridges of the femur. You can see over here, this is the popliteal surface and it is bounded by the medial supracondylar ridge and the lateral supracondylar ridge of the femur. Now we move to the lower end. We have completed the shaft. We said shaft is the long middle part of the femur. It has three borders: medial border, lateral border, and a posterior border. It has three surfaces: anterior surface, medial surface, and a lateral surface. While on the posterior aspect, there are upper posterior surface and a lower posterior surface. The lower end of the femur, it lies below the shaft and it articulates with the tibia to form the important knee joint. The lower end of the femur is broad and expanded to provide a bearing surface for the transmission of body weight onto the tibia. The lower end has two prominent masses. It has two prominent masses which are called as condyles. The medial condyle and the lateral condyle. These are two prominent masses. These two prominent masses or these two condyles are separated by a depressed area which is called as intercondylar fossa. The lower end has two articular surfaces. It has a patellar surface. You can see over here. This is the patellar surface. Over here, the bone patella is articulating. It has a tibial surfaces. The condyles, inferior surfaces, and the posterior surfaces articulate with the tibia. So they are called as tibial surfaces. It has two articular surfaces, patellar and tibial. Again, this is an image of the lower end of the femur. The lower end you can see is broad and expanded. It has two prominent masses, the lateral condyle and the medial condyle, which are separated posteriorly by a depressed area called as intercondylar fossa. It has two articulating surfaces, a patellar surface anteriorly. Inferiorly and posteriorly, the articulating surfaces are called as tibial surfaces. The lateral condyle of the femur is stronger, but it is smaller as compared to the medial condyle. It has a small rounded elevation on the lateral side just above, which is called as lateral epicondyle. You can see in the figure, just above the lateral condyle, there is a small elevation of the bone which is called as lateral epicondyle of the femur. The medial condyle is more prominent and it also has a small elevation which is called as the medial epicondyle. Just above the medial condyle, there is a small elevation of bone which is called as medial epicondyle. Above the medial epicondyle, there is a small projection present which is called as adductor tubercle. Now you can see over here this small projection present just above the medial epicondyle is called as the adductor tubercle. The intercondylar fossa, as we said, it is a depressed area present between the two condyles separating the two condyles. The intercondylar line separates the fossa from the popliteal surface. This is intercondylar line and it is separating the intercondylar fossa from the popliteal surface. By this we finish the lower end of the femur. In the lower end we said it is broad and expanded. It has two condyles, a medial condyle and a lateral condyle. Just above the condyles, there are small elevations which are called as epicondyles. Lateral epicondyle and a medial epicondyle. Just above the medial epicondyle, there is a small projection which is called as adductor tubercle. From these, the supracondylar ridges are running upward. The site determination of femur is very easy. You have to remember few points for site determination. The first and important is the anterior surface of the shaft of the femur is convex and is smooth. The head of the femur is lying in the upper end and is always facing medially. The linea aspera or the posterior border lie posteriorly. The condyles lie in the lower end. So you have to remember these 4 points for site determination. The first, head lies upward and is facing medially. The condyles lie downward. The anterior surface of shaft is smooth and is convex. The posterior surface of the shaft of the femur has a posterior border which is called as linea aspera. The femur ossification. The femur ossifies from one primary center which appears in the 7th week of intrauterine life, and it ossifies from 4 secondary centers. The 3 centers are for the upper end and 1 center is for the lower end. Ossification is complete by 20 years of age. Thank you, my dear students. If you have any query, you can contact me on the Google Classroom. Thank you so much.